Everybody, we'll make a start as it's just turned 6 o'clock. My name is Councillor Andrew Tromans and I am Chair of this Scrutiny Committee. I would like to welcome you all to today's meeting. I would like to introduce Karen Malpass from Democratic Services, who will be supporting us today, and also our Monitoring Officer, Aftab Razak. I would like to thank all members and officers who are joining us. There are no fire alarms scheduled for this evening, so if the alarm goes off, it's the real deal, and do proceed to leave in an orderly fashion. Please be advised that this meeting will be recorded and subsequently uploaded to our YouTube channel for public viewing. And members are kindly asked to raise their hands or turn their microphone on if they wish to indicate to speak. Scrutiny is the cornerstone of good governance in local democracy. It helps us hold decision makers to account, examine policies and performance, and ensure the voices of our communities are reflected in the work we do. Our role tonight is to provide constructive challenge, not to criticise, and as previously stated at all the meetings since the start of the municipal year, I think the expectation is that party colours get left at the door, and that's something I'm pleased to say that this committee has been able to adhere to. Tonight's agenda includes some very important items that deserve our full attention and thoughtful discussion. So let's work together to ensure this meeting is productive, focused and beneficial to the communities we serve. And with that, I would like to move to agenda item number 1. First of all, apologies for absence. I've received apologies from Councillors Baton and Lewis. Are there any further apologies? Absolutely. And just to say that I asked Councillor Westwood not to sit next to me, just to assist in not in chairing the meeting, but just to see if there's anyone wanting to speak, to make sure I don't miss anybody. It's helpful to have another pair of eyes. Agenda item number 2, appointment of substitutes. I note and welcome Councillor Bills as a substitute for Councillor Baton. Any others? No, that's okay. Agenda item number 3, declarations of interest. Do any members have any interest to declare under the Members' Code of Conduct? Okay. Moving on to agenda item number 4, the public forum. I will read out the advice, but I can't see any members of the public here, those who are not officers who are going to present to us. But I'll just remind everyone the purpose of the public forum is to provide an opportunity for members of the public to raise matters of wider community interest that either relate to an item on the agenda or a topic within the committee's remit. It is not a question and answer session, nor is it an opportunity to raise personal or individual issues. This should be directed through the appropriate channels. Okay, so moving on now to item number 5, the progress tracker and future business. This report captures, that's pages 4 to 9 in your packs. This report captures actions from the meetings held to date and highlights progress. I note there is an outstanding response required by the Interim Director of Public Health in consultation with the Director of Adult Social Care in relation to providing members of the committee with a breakdown of information per ward relating to life expectancy, health conditions and health inequalities. Can the Interim Director please arrange for these responses to be provided, please? Just an additional one on there, and not wishing to put anyone on the spot, but I did ask for a report on the impact of the removal of the Welfare Rights Service to be circulated to members of this committee at the end of January, and as far as I'm aware, we've not been in receipt of that report, so I look forward to receiving that as soon as possible, notwithstanding any staff absence, which is understandable.
Chair, can I update you? So the report is just going through final sign-off and it'll be with you.
Thank you very much, and I'd say no wish whatsoever to criticise or put anyone on the spot. It was just to note that we were expecting that at the end of the month, but it's good to hear that's on the way, so thank you for that. Returning now to progress tracker and future business, are there any comments from members, any issues anyone would like to raise at this stage? Speak now or forever hold your peace. I can't see anybody indicated to speak, so We'll take that item as noted. Moving on to agenda item number 6, adult social care telecare service. The report is between pages 10 and 24 in your packs. Can I invite Emma Matthews and Julius Olu to present the report, please?
So Julius and Nicola are going to present the report to you today and talk through the action plan. So I'll let them introduce themselves to you.
Thank you, Emma. Thank you, Chair, and thank you, members as well. What we're presenting here today really is the Council's approach to modernising our telecare service, whilst at the same time trying to ensure that it remains safe. Very important as well is that it remains sustainable. Sustainability in this sense is also us acknowledging that the financial sustainability of the service isn't solely down to just the charging to residents or the people of Dudley as well. And as we go through the report, that will become more evident in the options that we've tried to explore as well. Just want to assure members as well that this is not really about withdrawing any of the telecare services from people of Dudley. To the contrary, really, it's about us trying to modernise the service by making it much more person-centred, where the charging and the tiered charging that we'll talk about as we go through the report enables us to actually deliver a more fair and equitable service to Dudley residents, whilst at the same time ensuring that as a council we manage our financials appropriately as well. I'll just go a bit further into key aspects of the report, which has been shared already. Particularly would like members to note really that there is an MTFS savings and incomes shortfall of around 487 overspend for 26-27. We'll like members to note as well the range of options that we've put forward for consideration in terms of managing and mitigating against the shortfall as well, and for members to support in principle the proposed preferred option, which is an uplift of 9.8% from the 1st of April. And at the same time, we're trying to propose the introduction of a tiered charging system. But we're going to go into a bit more detail about that, in that we are going to make sure that all consideration is given to protecting the most vulnerable people as we try to implement this as well. I'll move on to just some background around the telecare service. It is a preventative service. It's a strategic service which we hold dear, and we know the people of Dudley and members in yourselves really think highly of the service. It does what we expect it to do, which is to prevent people going into hospital and ensure rapid discharge there as well, but at the same time helping people to live for as long as possible within the community independently as well. The service in itself has got its financial challenges, particularly around the MTFS as well, in that it was set a savings target of 487 million for 26-27. What we've detailed in the report are options. A detailed options appraisal was undertaken to ensure we have measures in place to deliver that. We worked very closely on this. Some of the options, though sounding very viable theoretically, we established actually through validation process with colleagues in finance that not all could be termed as cashable savings. So essentially what we've had to do there is identify that the uplift of 9.88 and the tiered charging are the most controllable savings that we can implement, whilst at the same time recognising that it's not the sole method of sustaining the telecare service financially. We've also looked at other options, including cross recovery, charging recovery costs from other council departments that the telecare service actually delivers services for, including but not limited to the out of hours service, which the telecare service runs for the whole council. And that's just one of the areas. Now that whole possibility around cross charging other departments needs to be considered in quite a few perspectives, really. One, in that it highlights the importance and value actually of the telecare service as it stands, but equally it brings to the fore the complexity around trying to charge or cross-charge within the council, because we are one council, and so we have to consider and explore such approaches quite carefully, and that's why it's not validated in the report today, but something that we will explore in greater depth as we go through the year. There is also the option within the paper, or the paper talks about us exploring the use of BCF funding. That's the Better Care Fund, which is more linked to the hospital discharge pathway. But equally, just because the telecare service plays a huge role around preventing hospital admission, but equally trying to get people out of hospital very quickly, telecare is a key enabler there as well. So just needed to highlight that. The report also does, I won't go through all of the detail, but it highlights all the other services that the telecare service supports for the council at the same time. Working very closely with our finance colleagues as well, we've established that although the uplift and the tier charging brings in a saving of about 168,000, there is also the possibility, well, actually not a possibility, there is an additional 130,000 which can come from savings from telecare kit or equipment in 26-27. So that further reduces the gap and brings that down to about 189,000 that we have to explore finding within 26-27 and going forward as well. But working very closely with the adult social care management team, we've been assured that, and our finance team, that we will keep an eye, we'll monitor that 189 million gap through the year, monthly financial monitoring, and look for ways within the adult social care budget to plug that gap, including looking for any vacancies if required as well. I've also got Nicola, who's the manager of the telecare service, with us here, and she can talk to us about the plan really as well, because I think the other critical side to this is making sure that we cause as least disruption and anxiety for the people of Dudley as we try to implement the uplift and also the tier charging as well. That's a very important part of it. So I'll hand over to you, Nicola, if that's okay.
Thank you, Julius. Good evening. So my name's Nicola Baum-Hammond. I'm the telecare team manager. And I suppose off the back of what Julius has already talked you through, I essentially want to highlight that we do recognise from previous committee meetings and scrutiny meetings that we've come to, that we do recognise how important the charging is and getting it right. We appreciate that we've had a previous charging strategy that was sort of enforced, and we had to essentially change how we charged those that live within council residencies, and we have learned a lot from that, and we appreciate that this isn't about, what we're trying to do is have a sustainable charging model now moving forwards, We want to increase our offer, you know, with regards to always piloting new technology, keeping people safe and independent at home, increasing well-being for those using the telecare service, but also those, you know, unpaid carers who also use the service to get reassurance and peace of mind. So what we have looked at with regards to the uplift is bringing in and protecting those, because there's 82% of our customers that use telecare have a basic package, and by that it's the pendant alarm unit and a smoke detector. And what we've recognised from previous questions that we've taken over the years from yourselves is that the increase, we don't want them to be, you know, the ones that they keep having the increase on. We recognise that there is an uplift this year, but what we are hoping with this model in the future is that it will protect those that are on the basic alarm package and recognise and make sure it is costed fairly in the tiers after that. And this is essentially so that those who have more complex needs, we don't drive them out of the telecare service because it becomes unaffordable to us. And then we're protecting, as I say, those that are on the basic alarm package. So with that being said, the tiers that we looked at were all around pricing. Again, we don't want to keep reinventing the wheel with this. We appreciate this model has been well thought into, and it isn't solely based around tech. What we've tried to do is price this based on how much the tech costs. So again, that does protect us when we're looking at new technology. We're bringing in technology is changing all the time, and we appreciate that could be out of date if we base the package on what's available right now. And we do want to constantly evolve and increase as the digital evolves with us. So the tiers do reflect that. They're done in pricing brackets. And as I say, that will be then when we go out do the assessment, we'll look at what the person needs and then price it fairly. As I say, constantly protecting that we do appreciate the 82% of our customers. We can't keep just uplifting for those people who only require the basic package. Again, lessons learned from previous years. We are fully supported by our director in terms of getting the timeline right. And if it isn't right at any point when we are phasing this in, we will hold and make sure that we do have it right before we proceed with the next phase. The first phase will be the uplift. That's the general uplift that we would ordinarily always have on the 1st of April. And as Julius has said, that will be 9.88%. The next tier that would come in, or next phase, should I say, would be for any new customers. So at that point, that would be the 1st of June. It's really important, though, that I'm working with CAPA currently and that we are going to use all of the council's communication channels to really engage with the customers. We appreciate that how we've done it previously doesn't always necessarily engage people. It doesn't necessarily support them to understand what financial support maximise benefits and other things like that. So we are really trying to essentially, we don't want anybody to be forced out of using a service they love. We want to keep them their well-being and their independence at home. We don't want to drive it to other high-cost services within the council because it becomes unaffordable. So we are working and engaging with people to ensure that they understand what is available to them. The new customers, as I say, the comms will start very early, and that's purely and simply because if they are going through the hospital discharge pathway, for example, they get 91 days free telecare. We want to make sure that there are no miscommunication and that they don't assume that it's going to be the basic charge, should I say, at the end of that, because depending on what equipment they have been assessed for, they may fall into one of the tiers. And I think the more complex phase is the final phase, and that comes in the 1st of October. And that will be affecting about 18%, we believe, of our customers that are currently connected, who have a much more complex solution to keep them supported at home. And that can be and that kit essentially is more expensive, and this is what has driven us to this. I have done quite extensive benchmarking with other councils and other local authorities to understand how they do their pricing. And most of the local authorities do have tiered charging, and that essentially is protecting, as I say, those people who are the larger part of our customer base. so we don't keep just putting their cost up to essentially cover the more complex solutions. So with all the benchmarking we've done, we do fall from a price point in terms of keeping the price reflective. It's not, we're not sort of overcharging in terms of the tiers. But the final phase, as I say, will affect about 18% of our customers. We will be working and as I say, bringing in a good lead in time, because that should come in by the 1st of October. But that is so that we can start working with people as soon as we get agreement and sign off. We can start to engage and really, because it is a smaller cohort of people, it will be a more person-centred approach. We'll be able to speak with them individually and really understand what we can do, signpost them, you know, for the financial support that they might be able to look into that they may not have had to consider previously, and any other benefits, of course, that they could, in essence, help them pay for the telecare. All of the communication channels will be used, so that will be like the e-bulletins, the councillor e-bulletins, the mailing list that we know we've got about 25,000 people signed up to, alongside obviously our own letters and engagements, to ensure that we are working with all these people. But essentially, I suppose for myself, being the manager of the service, it is the well-being of people. We want to keep them independent at home and making sure that they can utilise all of the kit and the future kit, because this is about a sustainable service and future-proofing that, so we don't have to keep going through different charges for people. Is there anything else that you want to add? Is that okay? Thank you.
Julius, Nicola, thank you so much for that report. I'm going to open it up to questions now. Councillor Ridney, straight off the bat then, Councillor Day.
Thank you, Chair. Can you just clarify, did you say that 82% of the users of telecare have a basic package?
Thank you, Councillor Biddy. Yes, that's correct. We've done that as a summary at the moment, and we believe it's about 82% have got the basic package, and that would generally include a smoke alarm pendant and an alarm unit.
By all means, ask us supplementary if you want.
I do have a number of questions to ask you. I was chair of Health Committee way back in 2013-14, and I remember seeing all the equipment that you could use connected to keeping health well. And you, in your report, you talk about wanting to maintain people in their independence, which I wholeheartedly agree with. We should maintain our older people living in their own homes if possible. How far have we advanced in that equipment? What are we offering people? You're asking them to make this 9.98 increase in what it's going to cost. What are they going to get for it? Because they're certainly going to say to us, well, what are we getting for that? That's only one question, by the way. I've got some more.
Do you want to respond?
Okay, please. Essentially, the uplift, it is all around the digital technology. So we know this has been, it isn't something that we've chosen to do. This is a nationwide upgrade, a communication network provider upgrade. So essentially, to keep the service going and to still support the systems, we've had to upgrade. And unfortunately, that was forced upon us. The digital equipment is more expensive, but there are numerous benefits around the digital equipment, and this is something that we have tried to communicate previously and certainly will continue to do so with this year's communications, because a lot of people don't need a landline, which has saved quite a percentage of customers who only had a landline to have the telecare service. And essentially they've been able to withdraw from that and therefore save money from that side of it. So the technology now is SIM-based, which has made it much more accessible for people who couldn't afford the landline previously. Within that as well, they do get a lot more reassurance in terms of the anything can be programmed remotely. There's a lot less need to go into the person's property, which for some of our customers they found quite unsettling. They didn't want people coming in and doing maintenance and different things for the alarm. but the equipment is more fail-safe. It's got a heartbeat now that pulses backwards and forwards, because we have, like with anything, and unfortunately it isn't always avoidable, things break, and you only know they broke previously anyway when you come to use it. So outside of the normal maintenance visits, what we have now is this pulsing heartbeat that goes backwards and forwards constantly, 24 hours a day, 2-hour service. And as soon as that pulse stops for any reason, we are an hour proactive service. So instead of reacting to situations when sometimes a person's already in crisis, we now have the reassurance that we know about that before hopefully they need to press the alarm. And that has given a lot of customers a lot more reassurance, and particularly carers caring for their loved ones, reassurance that we are becoming more of a proactive service as opposed to reactive as we have been when it was analogue.
These new systems are dependent on us having Wi-Fi, having broadband in our homes. How many of the present day users of the system have got broadband? Referring to the 82% that have got the basic package. I'll give you a starter. How many out of the 82% have got broadband?
It's not, you don't need to have broadband. It's SIM-based technology. So the SIM is you don't need to have your own broadband. So the SIM is a bit like a mobile phone in that acts as the line, so to speak, in.
Was there somebody else? Yeah, oh, okay, on the same subject. Okay, Councillor Bills, and then is it Councillor Jeffield?
Thank you very much, Chair. I haven't, I bet some people think, I bet she's got it. No, I haven't. I'm not that old. I'm okay. But I do look after a gentleman who's sight impaired and is getting excited because he thinks he's got dementia. You know, sometimes people are very, very vulnerable. Now, when the moment came for the landline, he already had broadband. So are you saying when we had the uplift, I thought we were going from landlines, you know, coming through the wires to the broadband, and he already had it. Are you saying that that wasn't necessary? I'm a bit confused because he was okay. He just swapped over. But just as I've just said that, I just want to thank you for the service, because he did have his electricity off for a while because I made him have the place rewired. But you did contact me and you did contact him and say, are you all right? So I like the system, but I'm trying to think of ways that you can save money and keep the system going. And I just wanted to understand what was happening when we went to broadband.
What we've suggested to people is, if some people want broadband for their own home in general, and that can be, you can have the alarm in essence plugged into that, and that's absolutely fine. But what we're saying is it's not essential for the service. So if he was only having that for telecare, not for anything he does in his own home, then he would not need that, because the SIM is what essentially runs the alarm unit. A lot of people have found that they had a landline and their network provider has come and upgraded them. We've worked with all network providers to have a data sharing agreement, so we would be aware when that happened and we could support and make sure they were also equally upgraded with the kit. But essentially they don't have to. And that is, I suppose, where it's a choice now as opposed to a necessity.
Anything further, Councillor Bills? Thank you very much. Thank you. Councillor Hill, you've waited ever so patiently.
Thank you. I just wanted to make sure I wasn't misunderstanding this, that the telecare service provides out-of-hours support to the council as a whole, whether that's the Dudley Council Plus, housing repairs and various things like the lone worker, making sure lone workers are safe. Am I right in saying that the council, you currently don't receive effectively an allowance into the telecare budget for that service you're providing to the council as a whole, and that's contributing significantly to the to the deficit in the service?
There is a contribution currently from housing, because previously we were funded solely by the housing revenue account. Obviously we were released back to our social care and the general fund. So there was at the time an agreement to pay an amount, but it doesn't cover all of the out of hours corporate responsibilities that we'd undertake. So this essentially only supports the repairs management centre that we operate out of hours and 24/7 over bank holidays, and the sheltered accommodations. Everything else that you see within the report, we do not get any contribution to ourselves financially for currently.
And through you, Chair, can I just to follow up on that? So what is the contribution that you are currently receiving? And just a reminder, what is the shortfall? I know there's some uncertainty, but how much, what proportion are you receiving?
I'd have to confirm an exact figure, but it's around the £200,000 mark with regards to a contribution towards the sheltered schemes and the repairs management. But for all that, if I just to give an idea, we took last year, I think it was about 65,000 calls for sheltered accommodations, including call-outs. And the repairs management, I think, was around 12,000 emergency calls out of hours, of which we also have to escalate the job, contact the out of hours engineer. So it isn't just as simple as taking a call. We also have to execute, if it is an emergency and it can't wait until the next day, the actual whole process to get the job to the handheld, find out who's on call, and actually essentially escalate the job so it gets done within the out of hours service time frame.
Any supplementaries, Councillor Hill?
Right, to that you're having to pick up such a large amount, and I know it's all the council's money, and you know, to some extent it is shifting things from one pot to another, but it doesn't sound fair and reflective of what's really going on.
Julius?
Thank you, Councillor, for acknowledging that as well. And in the paper, that's one of the reasons why we've put that option of exploring with other parts of the council the possibility of recovering some of that cost, really. But we recognise that it's a more complex one, because the conversations need to go in depth, and we need to make sure that as one council, it's constructive, and we manage the unintended consequences, if you see what I mean, possible. Yeah.
Councillor Dale?
Thank you, Chair. Sorry, before I dash that black coffee all over myself. A couple of things. It makes clear sense to me in terms of why you would start to do this now. I know you benchmarked and said that you've spoken and looked within councils when kind of exploring new technologies and things. A couple of our neighbours are really ahead technological wise, because I've seen the products they use. They're in our homes already, in North Shropshire and Wales. Hopefully we're exploring kind of down the lines. Have you heard of the company called Abelia? Massive Swedish company. They deal with kind of like internal, they're almost like iPads and day planners that are situated around homes, ideal for kind of older people that can sort out what they're cooking. They can set it with QR codes, really, really good. Definitely go and explore that. But for myself, the technology side of things, I think most benefits when we're coming out of hospital and getting back into kind of a normal day, daily life and routine. And those people obviously are going to be in contact with this technology for a very short amount of time versus the people that are going to be with it probably for the rest of their lives. What steps are we making to make sure that we're keeping the exposure to technology and these people that are in that time frame of coming out of hospital and kind of getting back to a normal life at a bare minimum, so that we can take these products and use them in the places that they're most needed, obviously on a long-term basis?
Everything that we use in telecare, so it's rented, as we know, for the customers. So we upcycle everything. So anything that comes through the hospital discharge pathway, and for example, is only used for 91 days, we bring back in, cleanse, reset, and it goes again to the next customer. So we do keep our equipment spend really low, and hence why we've been able to save a lot of the budget that we would have had allocated this year and contribute it towards what we need to recover. We're always piloting new technology as well. So essentially, we engage with the local authorities. I'm part of the LGA and the ADAS meetings, where we look at what other local authorities are exploring, learn from what they've done. So we collaborate and also look at what can be shared, best practices moving forward, what worked, what didn't. So essentially, we're not all trying the same things, but we learn from each other. But that's exactly why I want to do the tiered charging, because technology changes all the time. I'm very, very aware that everybody's tech savvy these days. They want to try different things. I actually get quite frustrated when people say, oh, they won't be interested in that. They really will. And I think that engaging with people and moving at a pace that suits them is really important. I've got digital champions in my team. It's also we're not just about giving them pieces of kit. If we can use technology they already have, if they are particularly tech savvy, for example, we're all about engaging with them so they're comfortable, and we build that rapport very early on. And it could be something as simple as a Ring doorbell, making sure that they're utilising it so they can see who's at the door before they answer it. We work with people who have got Alexas and get the most out of it. It does far more than just ringing mom, dad, cousin, brother, and seeing them on FaceTime. We've got them to save, do shopping on it and different things. So we really do try and engage with people with the technology that they've already got. So essentially, they're not actually having a service from telecare, but by building that rapport early, keeping them engaged with us, essentially when the time comes, or if the time comes that they do need it, they have that trust in us already as well. And we find that really, really important, and it is a key feature of everything that we do. But the tiered pricing is essentially to protect. So any new technology that we're piloting and bringing in, that's why you'll notice it's in price brackets as opposed to a falls package or a dementia package, because the technology will change, and we don't want to keep doing this over and over again, because we understand it's quite resource intense, and we do need to get it right. So essentially, it is all in price brackets, so that exactly like you said, whatever technology we bring through, it will fall into one of those price brackets. But we make sure that we use and reuse everything over and over again. Nothing goes to waste. We really are quite passionate about that. So.
No more supplementaries. Just as a point of housekeeping, I'm more than happy for members, if they've got supplementary questions, just to carry on if it's in the same vein. I trust each and every one of you to ask appropriate questions and make valuable contributions. Over to you, Councillor Bills, and then Councillor Red.
Thank you very much. I've heard. There's just one thing. My uncle, sadly dead, but he in the last 12 months, he was receiving telecare in Shropshire, and the basic didn't cost him anything. And yet here, I've got a gentleman I was talking about, and he has to pay so much a month. It comes from, does every council fund it the same way from the housing revenue account, or do other councils have other ways? How come Shropshire can afford it and we can't? That's the basic question.
I wouldn't be able to answer why we couldn't fund that, and give it free of charge. I know that when the charging strategy came in previously, it was free of charge, or included certainly in the rent that was paid, should I say. We've made a conscious effort to really try and make the costing sustainable for the future, because everybody that I speak to really thinks highly of the telecare service. It's very much part of our prevention moving forward and the offer that we want to do. And to have a cost to have the service essentially is what keeps the service going. And unfortunately, I think if we weren't to charge for it, we just wouldn't be able to do the service that we've got in Dudley. But when benchmarking, some reassurance that the telecare offer within Dudley is far more superior to anything I've benchmarked to. And that is purely because of the offer that we've got from the digital champions, the piloting of the new kit, we're already 70% of the way through our digital replacement programme to ensure that everybody is safely upgraded before the full switch over comes. And also that we are making sure that everything that is done for the person is person-centred. So on top of a falls response as well, which a lot of other local authorities are just not able to offer.
Yes, just a follow-up question about who's paying what. Do the NHS make any contribution to this system? I mean, they don't like pay it up at the best of times, but I'm asking you, do they pay anything towards this system? Because in your report you said to keep them out of hospital, you know.
Yes, we could go back and just cross-check that in greater detail, but one of the options we are going to explore in greater detail
I wish you the best of luck then with that. That's like getting blood out of a stone.
is trying to see if the Better Care Fund, which is
If we're going to improve the equipment, which is what you're saying, and the equipment, as far as I know, can do blood pressure checks, heart checks that would assist our comrades in the NHS, GP surgeries, there should be some sort of financial contribution. And not to be flippant, I'm looking at John. I take it we're paying the bill for the children's calls and an escalation of out of hours, just to check. Okay. You'll let me know. Okay. But I do feel if we're going to improve the system and make it to help people to stay in their homes longer, it has to be a partnership with the NHS, not necessarily public health, because this isn't about public health. It's about people with long-term illnesses, really, as my colleague here was saying.
yeah. We thank you for that, Councillor, and we acknowledge that, and that's why we will be exploring in great detail how the Better Care Fund can make a contribution to it, really. Yeah.
Could I
Thank
just
you.
add? Oh, sorry. Could I just add one
Of
part
course.
to that? Apologies. We also make sure that we've already some of the partnerships that we already do, obviously with us doing a falls response and a service that is something we're really proud of, that we can still fulfil end to end in house in Dudley. We also do already work that is in essence preventing ambulance calls, which we are aware of, and we will be building into also what we're asking around the funding. But we've also built a relationship with the clinical hub in Dudley, which when ambulance times were peaking, we brought that in 2022 off the back of COVID. And that's another partnership that we have brought in as well, where we will respond out with a clinician if they are able to. And that again is another offer which keeps somebody and being treated in the community as opposed to conveyed to hospital.
Thank you. I'm going to use my privilege as chair to ask a few questions, if that's okay. So if I've understood correctly, the recommendation we're being asked to approve, what you've said is your preference is number 6. Am I to understand that, and apologies if I got this wrong, the 80% who received the basic service, they will be asked to pay a 9.88 uplift?
Yes, Chair, that's correct, yeah.
Thank you for confirming that. I thought that was right. And then I understand that, but with the tiering and also the costs that occur to new customers and those who receive more of the service will be asked to pay more. Just so we can bring it down to the level of a service user, how much more a month or a year, if you're able to give those figures, would that uplift be?
So the pricing is broken down into 4 tiers, well, 3 tiers on top of the basic package. So the basic package, like you say, would just have the 9.88% uplift. Tier 1 would go up to £29.99 per month, and that's with cost of equipment up to £400 allocated to it. Tier 3 would be equipment cost up to £550, and that would be £34.99 per month. And then the final price bracket is tier 3, and that goes up to £800 worth of equipment, and that's £39.99 per month. All benchmarked against other local authorities as well, so we are still comfortably within what would be acceptable against other local authorities.
Thank you for that. I think it's really helpful just to understand like how those costs would present in the you know, the 20% of those who receive the higher level of service. That's fantastic. Okay, thank you for that. I'm gonna I understand that Councillor Hanif would like to speak as well.
Yeah, thanks, Chair. You mentioned in the report, and it sort of sets it out on page 20 of the report as well, further work that still is required, you know, to where further resources will be needed. And you mentioned a series of next steps. Any idea of what kind of resources you'll be looking for, and these steps that you set out, next steps rather, to progress the outstanding tasks? What sort of timeline is required or you've set to actually complete those? So it's easily sort of there to put down, but there should be some kind of an idea of completion dates and so on.
Thank you, Councillor. One of the tasks we say we will embark upon after this committee is to set up a project team focused on delivering the implementation plan. So that team will be responsible for implementing the next steps, as well as the tasks linked to the plan that Nicola has kindly gone through. And that team will be reporting into the adult social care leadership team, chaired by Emma here as well. So that's as far as we've got in terms of delivering. I don't know if you want to add anything to that, Nicola. Yeah, yeah, that's fine.
Only in addition to that, I would just say that we have said that we appreciate there are lots of other options that we know we need to explore, but I hope you can appreciate we needed the time to do that properly and be able to come back. And what we were going to request is that we come to maybe another meeting later in the year, towards the end of the year, where we could then update, because we feel that once we've put the project team together, had time to explore in more detail some of the other options, and maybe have some of those more sensitive conversations, particularly about asking other parts of the council maybe to contribute, as we know is much needed. But we feel we'd be better placed. I would love to give all the answers now, but I think we do need the time to do that properly. So we've tried to address the key parts of what we can implement within the foreseeable time frame that we've talked about up until the 1st of October, and then give an update after that, so we can update on the charging, but also the other options once we've had time to explore them within the project group, if we may.
Thank you. Anything else, Councillor Hanif? Okay. I can't see anyone else indicating they want to speak, and obviously we've been asked to approve a recommendation this evening. Just picking up on the discussions that we've had, could I suggest that two things, that we add the recommendation, a note to bring back for the a report probably to the whichever committee succeeds this one. We don't quite know what the shape of scrutiny will be like next year, but whichever committee this falls into the remit of. And I wonder if there's a possibility of getting some slightly more explicit wording about seeking to recover costs from external partners. I appreciate, as alluded to, that might be easier said than done, to put it mildly, but yeah, my feeling is from the tone of this discussion is that we can't keep asking the service users to stump up for the money without exploring all other options to fund the service. So I'm going to just take a look around now and see whether, with those few changes to the recommendations, whether this committee will be happy to support them or whether we need to take a vote.
So, sorry, Chair, could I just add to that, to also to look at more fairly covering internal costs. I don't want us to end up down a, where you're invoicing line by line items, but it does sound as though there is quite a big gap between what you're currently receiving internally and what would be fair.
Thank you, Councillor Hill. I think that is, we can maybe make the wording a little bit more explicit in there. So with those kind of changes, with those kind of notes, the recommendations, is this committee prepared to endorse this, or do we need a vote? Okay, I'm gonna do it on a show of hands, if that's okay. Who, with those amendments discussed, who would be prepared to support the recommendations? I think that with those caveats, I think that is unanimous. I do think, obviously, we can't keep endlessly increasing the costs to our service users, and that's obviously appreciating the report you're given. But ultimately, we cannot find ourselves as a council in a position where we have done previously, where we are storing up trouble. So we need to take reasonable steps to reduce budget shortfalls. Otherwise, we are just creating problems for ourselves later down the road. So with that, I want to thank Emma, Nicola, and Julius for giving the report. With those few caveats, it is unanimous that we are prepared to endorse those recommendations.
Chair, sorry, just a quick one. It's something that's just come into my head. Where these are being supplied into our private suppliers, and obviously not directly into homes that are being managed by people themselves and obviously paid for by themselves, do we ask for a contribution from any of our providers at all for these products?
Sorry, could you just confirm, when you say providers, because I know we've got equipment in the sheltered accommodations, which is funded by the HRA, essentially might need an uplift of some sort, but when you say...
Our direct customers that are using these products currently are paying for them directly, but paying for them themselves. But where these products fall into our providers, so our people that are obviously putting care in place for elderly, supported living homes, do we ask for a contribution back from these packages at all, or not?
Not within the sheltered scheme, so they fund, because HRA are funding that, so we don't get any contribution. Where the only other providers is where it's a council owned building, so like the private and it's rented, so that would be like the Chubb properties and independent providers. We do get a contribution from them to support. However, we are looking at those contracts moving forward to understand in terms of some are choosing not to upgrade, for example, and we can't enforce that on them. So we're having to have those discussions now. But from our council, so from our own internal shelter schemes, we get no additional monies from the people living there for the products that they receive. They are part of the rooms and the accommodation.
Yeah, just to come back on that, from our private providers, what are we getting back percentage-wise? Because I know we pay the full amount for whatever comes in. So we make that... So obviously as a business that probably does the right thing by its service users, we pay the entirety, because to us it's an hour's pay. Do you know what I mean? It's very, very minimal, but for the longevity of the service user, I think it's ideal. And I think maybe we should be a little bit tougher with our private providers if that's the case.
And I agree. I think that's what we need to look at. And this is why we've had some quite difficult conversations with those people and those providers, because where they're not willing to sort of cover the cost to us, we are becoming, now digital equipment is so much more expensive, continue to provide that kit. And therefore they are in essence taking the monies for the people living in those accommodations but not paying for the kit. So yeah, they've been some quite difficult conversations we've had of late. Those that are willing, we can continue the partnership, but unfortunately for those that were not willing to pay for the kit, we've not been able to continue that under the digital framework.
Okay, I'm going to bring the discussion on this item to a close, but thank you everyone for your contributions. Just to clarify what the next step is going to be, just to say we would like to see some slightly revised wording around cost recovery in future, internally and externally, and also an undertaking to bring back a report to the future committee. If we could get that circulated to members just to sign off the final wording, we'll aim to get that, to hopefully get this all closed out either later this week or early next week, if that sits comfortably with you. Is that okay with everybody else on the committee? Brilliant. Thank you very much. And thank you once again for the report. Thank you. Turning now to agenda item number 7, the education report, which you'll find on pages 25 to 36 of your pack. Can I invite Matthew Monarch to present the report, please?
Thank you, Chair. And for members, this is a report that we normally bring annually anyway. It's around the outcomes in particular of the Dudley children from their main examinations throughout their educational career. But it also then, for this report this year, just invites further information as well around where we sat with school inspections, but also around some of the other work that is done within the education team. So I'll go through those elements of it. I won't intend to necessarily go through all aspects of the report. Essentially, before each of the national outcomes, there is an explanation of what that means, and hopefully you'll have had that opportunity already to read that. And I'll very much more focus on what those outcomes have been, and maybe around the national picture with it, and a gap between Dudley and national, if there is those gaps, and look at what we've been doing so far to reduce those gaps going forward. So the first set of outcomes that we look at is good level of development. This is one that sits within the early years. It's reception children. The children have been at school for a year, but also then the work that is done previously with nurseries, private providers, as well within that. And you can read from there what they need to do to achieve a good level of development. Outcomes for children in Dudley have been below national average. We are at a couple of year increase on those results for us within Dudley, but still way below that national average at this moment in time. So we are at the moment in Dudley 63.7 against a national average of 68.3. You can see a breakdown there of what that would be for boys, which we seem to do better than national, but girls below that. Not necessarily gone and found any of those reasoning behind what that would be, and whether there's any element of, again, sometimes it could be around determined around summer births and things like that, so it could go deeper than some of that. But in terms of those with children with SEND, again, 31.6 of children with SEND achieve expected levels against a national average of 24.9, so we are above the nationals in there, but obviously that's still behind a national gap, essentially, because all gaps go to the main national level of it. We've also got the information there of children that are supported through the virtual school, and that's 30.8% have achieved that with those that are through our children in care. It's important to share that there has been an increase of achievement from the previous academic year of 0.8%, and as I said, that's a 2-year increase. There's a significant amount of movement from the government at this moment in time, the Department for Education, around good levels of development. We know around the best start in life. It's a key element of the government agenda at this moment in time, and that's important because actually giving children the best start in life from a very early age, not just when they start going into a nursery, but from birth onwards, is really important. And every local authority have been set a target from the DFE, and Dudley's target at this moment in time is 71.9 to reach by the end of 27-28. Now, there's a national target still of 75%, which we understand, obviously that still is a significant increase that we would have to make over 2 years at Dudley to reach that of around 7-8%. We're not happy that necessarily it sits at 71%, although it would be a significant increase for the children at Dudley. For us to be the best that we want to be, we want to also be achieving at least that national target too. So we won't be necessarily aiming just to get the 71.8%, but we will be looking at achieving, we'll be looking to achieve the 75% as where we can as possible. Significant work has already been done with our early years. Even only this morning, they've had a huge stakeholder event about how we can bring all partners together to improve those levels of good level of development. Because it isn't just around our early years, although they will be the key lead within our area in children's services to support that, our early years service. But we are having to, working out alongside, obviously, our Family First, social care reform, as well as working within across our education and school improvement teams, as well as also health being part of that as well, especially around the public health and support. In terms of our phonics data, so obviously children will take a test at the end of year one. Again, obviously a lot of our children do get tested significantly in England schools. But for us, Dudley children achieved 78.2% of assessment pass for the phonics test against the national average of 79.9. Again, that's been an increase again year on year for that. The schools work really hard in terms of that. And there's a real push, and has been a real push in our schools with school improvement around phonics and around that, but also not just around there at year one, but actually continuous of phonics all the way through their school life, so that we can improve that level of literacy going through. For children eligible for free school meals, pass rate 65.3% against a national of 66.8%. So again, just below there. It is important to remind that if a child doesn't pass their phonics or doesn't get the significant number that they need to get correct at the end of year one, they do get a chance to, they do have to repeat that in year two. So that's why that kind of understanding of the phonics and the importance of how language is built up for the children is there, and that isn't necessarily published nationally, but again, the government are looking at the moment of a pass rate of 90%. To get to the end of their phonics screening at the end of the time they finished year one. So both national and Dudley's target there is a significant increase that needs to be made. In terms of Key Stage 2 SATs, the end of year 6, very much you can see the different papers that are there, and are very much focused on the combined reading, writing and maths. Here is where we've got some real successes in particular. Our combined levels in Dudley have improved by 3% to 60%. That is the same level as it is nationally, regionally, and just 1% below national. And I think there's a real testament to the school's work in particular, 5% increase in the reading, writing and maths in their last 2 years for children in Dudley. And it's something that the Department for Education has commented on for us as well for our schools. You can see the individual results there in terms of those that have got their writing and their reading and their maths. Whereas last year we were actually quite, as a school improvement team, we were focused very much on improving their mathematics. And we can see again, there's a big increase of 3% on mathematics results. It's important to also say that the school improvement team, which further in the report, does quite a lot of moderation around the writing in particular. So there's significant amounts of moderation, and every school has to be moderated on a cycle of every 4 years around that. In terms of Key Stage 4 and GCSE Level 2 results, obviously Level 2 equivalents would be some of the vocational BTEC qualifications and the GCSE. Obviously, this year would have been the first year that we didn't have progress data, progress scores, obviously coming out of COVID, and that was the year that children wouldn't have sat to actually gain the progress from going from year 6 all the way through to year 11. Attainment 8 average, which is essentially the best 8 qualifications, including English and Maths within them. The point score for that is 42.6 for Dudley, which is significantly still below national at 45.9. That is still an area, although that's shown some small increase from 42.3 for the previous year. We know there's still significant work to be done on general levels of attainment for that, and that's essentially mean about getting some of the higher levels of results on there. For those that have passed English and Maths, again now the government have come away from some of their overall levels of expectation, what they present within their data. These are kind of the key ones that I would look at. So percentage of pupils achieving grade 4, which is a standard pass in both English and Maths. For Dudley is 54.6%. Now that's against a national of 65%. So we know there is significant work to do to hit that standard of just a standard GCSE pass. For those that are to achieve that for grade 5, which would be seen obviously as a good pass, above in English and Maths, we're at 40.9%. So slightly less of a gap to the national at 45.9%, but there's still that gap there again. Again, both of those results have gone up in these last 12 months with our schools, and we would hope to continue some of the progress that's been made with our GCSE results. For school attendance and persistent absence, I think for many years we've sat here thinking that our school attendance isn't great and we can always be better. But actually overall attendance to school has improved to 93.1%, and that has hit the same level at both regional and national averages. It's a 0.7% improvement on the previous year. More children are attending school. In primary schools, attendance is 94.3. That was below an average of 94.8, but still showed a 0.3% improvement on the previous year. In secondary schools, the attendance is 91.6, and that's been an improvement of 1.1%, and that's been our biggest key in terms of improving the overall, and that's above that 91.4% at national. In special schools, our school attendance is 90.2. Again, that's an improvement on this year, but 3.1% above national. And I think that, again, is testament to the work that our special schools do with our children and the curriculum that they provide for them. Overall, 19.2% of children missed at least 10% of school attendance. In primary schools, that was at 13.5%. Again, it's an improvement of children that missed at 10%. In secondary schools, essentially, you think that's nearly a quarter of children in secondary schools missed 10%. Again, nationally, it was the same level, 24.3. Special schools, 30.6% missed that. Again, the national level is at 35.8. And obviously, there's significant needs that come with some of those children that would need sometimes that absence levels. But it is still better than the national level. But there's still some significant levels, although we're nowhere near at the levels that we were pre-COVID. There is some improvement there. And I think that is down to very much the work that is done by our school attendance team. We've had over 200 targeted support meetings across schools in Dudley. And there's very much now more work from the DFE. They provide toolkits, data that is provided on a regular basis to schools for them to work through comparative data to other similar schools and gives them different areas to look at improvements within it. It is also obviously a significant impact. If they don't attend school, they won't be achieving the results that they should be achieving. In terms of school suspensions and exclusions, again, national statistical data for suspensions and exclusions is always 12 months out of date. It always lags, and that's for to go through the full census for a full 12 months to gain that information. Again, as I previously said before, our exclusions rates are high. Our exclusion rates are continuing are above those nationals, but we have reduced the suspension rate, and I think again that is very much key to the work that is done by our pathway strategy and work in schools. That is still not good enough. Still too many children get suspended. Still too many children get excluded. But again, there is significant work being done through the pathway strategy, which links to the SEND and AP sufficiency, about trying to improve strategies for schools in terms of avoiding exclusion, as being exclusion should be as a last resort for a head teacher to make that. The provisional data that we have for 24-25 is showing that there is still that work to be done within it, but that is only provisional data. It's only data that we hold ourselves, and the national data won't get released for the last academic year, 24-25, until July 26. In terms of school admissions, in 2024-25, school admissions team achieved 96% in top 3 offers for secondary schools and 98% for top 3 offers for parents for primary schools. That is very much, again, in line with national averages. We've also had 629 children that have been placed into schools through the Fair Access Panel, and the breakdown is there as well. Obviously, sometimes those will come through that Fair Access Panel whilst waiting still for other aspects to be done, or they might be new into an area, and we place them through there whilst we find the most appropriate school for them to do that. The Fair Access Panel was very much highlighted as good practice through a SEND area inspection back in January 2025. In terms of school improvement team, our 2 school improvement officers in particular very much work alongside schools, mainly maintain schools, but do also work with some of our academies as well, because there are still elements of statutory duty that we have with our academies, especially sometimes around like assessment, that needs to moderation of assessment, but also things like school attendance and school exclusion. And they've managed to, within that year, to visit 108 visits to different maintained schools, and some schools would get more dependent on their need for support if they were close to an inspection. In terms of the moderation, all 16 moderators successfully completed the standardisation exercise. Again, that's to support the Key Stage 2 data. And I think that just to feedback that there's certainly a lot of the training that's been done around our assessment is very much has been overwhelmingly positive across that. In terms of our Black Country Music Hub and Dudley Performing Arts, remember that Dudley Performing Arts are the lead partner of our Black Country Music Hub, and we are now in our second year of that. During 2024-25, the DPA worked in 89% of our schools. Again, they don't have to. Schools will buy into that element of it. Some schools don't, but some children within some schools that don't buy into it will still come and have music lessons. It's not exclusive to that. And you can see the amount of individual children there that receive instrumental lessons. Some receive classroom lessons, and that is only a snapshot of 1 year. Because some years, some schools, and they have instrumental lessons within their classroom element of it, might only have it for 1 year, then that's been their impact, but it'll be a different year coming through it. But it's very much a key element of the work that is done there. Very much linked with our special schools, they're very much a significant part of it, and those of you as members who have been part of the Special Schools Christmas concert will understand the importance of music for our special schools. There's also a very strong link with our virtual school. Over 100 children in care receive weekly instrumental lessons that are paid through as part of their education plan. And also the Dudley Performing Arts have 3 arts ambassadors who develop wider arts opportunities for children in care. Also work with our Youth Justice Service on the Boom Project, where young offenders channel their creativity into developing their own music. And we've also got 3 schools that have, within Dudley, have also been part of the Arts Council England and our DFE Lead Schools programme. And they are Blowers Green Primary School, Earls High School and Penns Meadow Special School, all exemplifying excellent musical opportunities in their schools. In terms of Ofsted school inspections during 24-25, you will be aware, obviously, that there were no overall judgments given from September 2024. So where we used to be able to state how many good schools and outstanding schools we used to have, we weren't able to take that there. And obviously, we are now into a new framework again. So last year we had 22 school inspections in Dudley. 17 were in primary, 4 in secondary, 1 in special. Very much a focus, it felt like, on Hell's Owen schools in particular in that time. 13 of them were full Section 5 inspections, 8 were Section 8, which meant it was more of a monitoring visit and was more just looking at whether they were still at the same standard as they were previously. And 1 was just a monitoring visit from a school that was still requires improvement and needed further support. Of the full Section 5 inspections in primary, 64 of them achieved a good or outstanding in the quality of education, because you still had the 4 elements or 5 elements if they were early years. 91% achieved good or outstanding in behaviour and attitudes and personal development, and 82% achieved good or outstanding in leadership and management, and 82% achieved good or outstanding in early years. In secondary, which were 2 of them, 100% achieved good or outstanding in every area of inspection. Of the Section 8 inspections, 100% remained good from their previous inspections, so that was pleasing to see. So I guess in conclusion, from the education report, we know there's still improvement that needs to be done, and the work that needs to be done in schools and the support around them. From November, we're aware of the new framework that schools have been inspected then now since the beginning of December. There was one of our Dudley schools that was used within the pilot that was going before that. That was very supportive. And what we're trying to do now is learn from those that have already had inspections as to what the understanding of how the framework is very different for a school and the responsibilities for certainly the leadership in schools. We still await the white paper, and even when I was writing this in November, we were still expecting a white paper, and we've met with DFE colleagues only this afternoon. We're still writing the white paper, but it is expected imminently. We're obviously coming up to half term very soon for schools, and we do expect it to be very soon after that now. That is certainly what we're starting to pick up. That will very much be around the importance of mainstream inclusion, workforce development, and that further strengthening of SEND and AP sufficiency. We've also had just recently the curriculum review, and again that will change very much how aspects of the school curriculum may well be taught. There's been very much a focus over previous years around the EBAC, and the EBAC being essentially English, maths, science, a language, a humanities being the basic focus of you having to do that. It's not been a certificate that anybody able to get from that, but have been the focus from previously. There is very much the recommendation that schools can go a little bit broader now with their level 2 qualifications, which will be so much better for individual children. And the significant part for us over this next, and has been already since September, but starting to write an education strategy. It's something that I think in my many years of working in Dudley, both within a school as a previous senior leader and head teacher, has felt that we've maybe not been as strong on having our own strategy in education that is co-produced, it's worked together with all stakeholders, including yourselves as members. And we're very much in that process now where we have essentially 5 kind of work streams that are working through best start in life, transitions, school attendance, mainstream inclusion, and that final element of school outcomes. And we intend to, obviously, we're working through that at this moment in time, hopefully to have a draft by April, and then over that next term to be able to share that in a draft format, so by September 2026, we have a full education strategy which has been co-written and supported by every element. Thank you, Chair.
Thank you very much for that report. I'm going to open it up to questions. Councillor Ridney, the floor is yours.
Thank you. Thank you very much for the report. Can I just make a request? And you must hear this at governor's meetings all go, can I have pictures next time? I do these figures in pictures much better.
You have a little box.
Little boxes. I love those. I can understand those better. You must have had that at governor's
Point taken,
meetings.
Councillor.
Come on. We've been trained well in Dudley. We like pictures in our reports. Thank you. So thank you very much for the report. It's nice to see that we are doing better, as I know from the school that I'm involved with, and it is good. The only thing that is really giving us nightmares is attendance. It was 96% before COVID, and we just can't seem to crack it beyond that 94, can we? They're all coming up with all sorts of ideas, but we just can't seem to crack it beyond that.
You're happy we come back, Chair? Thank you.
Sure.
No, I agree. And nationally, we're not hit that level. I think we're starting to see some, even in that first autumn term, again, we're still making improvements on what the previous autumn term would have been last year. We can see that the national picture is improving. Nationally, we haven't got there. There is lots still to be done around it. It's very much around trying to break those barriers. And again, we're trying to link ourselves within our sufficiency of how we can improve that. Ultimately, when it comes to a framework, if you're not making rapid progress with some of these young people, you're not going to get some of that more outstanding levels there. But we continue to work, and I know individual schools are working intensely in trying to improve their attendances.
Commentaries, Councillor Ridney.
So the nursery level, early years level, I think we've still got a lot of work to do with them coming in. I spoke to my head of early years this week, who tells me that of the intake we've got coming in September, there are 15 children, and we have an intake of about 60 in the nursery. Still not dry. And that is quite worrying. It is. But the phonics, yeah, we had a large percentage that didn't get it till year 2, but if they're coming in at the sort of levels they are at reception, we can't expect it. We can only work hard and keep going at it, but that is a problem at the moment. But that's where we're hoping that the hubs can help us. Thank you.
Would you like to come back at all?
Just I agree with you, Councillor. I think that's why we want to really, that education strategy and that first part of that first pillar of our strategy is about that best start in life. And that's why today that early years it's been our wider stakeholders, because we've got to get to that consistent level that when they're coming into our schools and reception, that they've all had a better understanding of what that best start in life would be, and that then we're working alongside our public health colleagues with some of that as well, in terms of what programs we can put in. So absolutely.
Thank you very much, Councillor Bev.
Thanks, Chair. Fantastic report. I do always look forward to the education report. Just a couple of bits. So obviously, new Ofsted framework in November. How many schools are likely to be due for an inspection at that point? And obviously, we know about the kind of the new pressures on leaders with that. What's the greatest risk to our schools with that new framework?
That's a good question. I think in terms of the amount, we've got we certainly are aware of 5 or 6 at this moment in time who are due imminent. We've had one this week. Obviously, I can't share necessarily any of those details from it. And we've had 2 early within the framework and the time period. So we've had 3 in that, 3 others, so we've had 4 at this moment in time. I think the biggest pressures is actually understanding that when a school has previously been an outstanding school, it's a completely new framework. And actually you cannot compare any previous framework with this framework. This is a brand new framework. And it's really important to understand that as members, but as the public, because, and I think, to be fair, Ofsted have shared that as well. You know, you cannot compare an old framework with this framework. The pressure we're understanding from those early ones is on the leadership. There's very much a focus on that leadership being there. But it is important. It's still around self-evaluation. The schools, leaders need to know their schools well. And I know they do. You know, and that's, if they know their schools well and are transparent, as they will be with inspection, it's important that they are with that. I think what we're still very much picking up is that Ofsted are still very care about the well-being as well of their leaders, and are continually checking that as part of any inspection. I'm pleased to see that.
Thanks for that. Through you, Chair, just another question that's slightly off topic from that one. I'm not expecting you to have the figures for this now, but it'd be interesting to know, in terms of absence, the level of unauthorised absence due to holiday. So students not in school that are off on holiday, and how that potentially compares sort of regionally and nationally as well. Again, I'm not expecting you to have that at your fingertips now, unless you have.
No, I haven't got that. And some of that data may not come out yet, because I'd have to wait for the statistical release for that. We may have some early view. We have our view year data, which is a DFE element of it. That doesn't necessarily give a full picture sometimes. It's sometimes a rounded up figure. You may not be able to see a national trend with that one. We may have to wait until the statistical release comes out for that, which would be the end of the academic year.
Brilliant. Thank you. Appreciate that.
Thank you very much. Councillor Day.
Thank you, Chair. A couple of questions. I know that obviously I've been dealing with the Cabinet Member for Children's with a few things regarding kids and attendance and stuff. So a couple of questions, and you'll forgive me if I ask them. In the paperwork, I didn't find anything, or you didn't read anything out, and I was trying to follow, but it's been a really long day. How many kids are there that have been deregistered? I know that you've provided figures for kids that don't attend school, but how many kids have actually been deregistered? Do we have the figure for that? Obviously, it becomes a major thing in today's society. When I went to school, I know it wasn't that long ago, 25 years, but nobody was deregistered. Everybody went to school, and it's becoming more and more of a thing of society now that if kids don't like the way that their children, if people don't like the way that their children are taught, the simple thing is to deregister them. That's the first question.
That data, yeah, you know, it's not here. It's not something I've necessarily previously given, but we would have some of that data available to us in terms of elective home education. I'm guessing is what you mean by the deregister.
Can we obviously request that information afterwards via email is fine. More than just elective home education, because I know in the ward that I stand in, obviously it's a more deprived area in Dudley than most, and sometimes schooling life just doesn't work out for these kids, and we need to really kind of hold them dear. But do we look into the correlation between deregistered numbers from schools and the schools that are having those deregistrations, and what are we doing to make sure that they don't kind of continue to go up, and is there a pattern forming in these schools? That's the second question.
We do look at that, and we have that within our own governance and within our education. So the school attendance and support team would do that, but we also bring that into our team around the school governance meetings as well. We do look, and if we feel that there are any patterns in it, we then go to challenge the schools with any of that conversations. There isn't any direct correlations with some of that directly.
The last question, obviously, are we able to get that data kind of that I requested first regarding deregistered children first? That's perfect. How quickly do we push, because obviously I know that we've talked about national curriculum, which I guess we were all kind of fortunate in this room that national curriculum worked out for us, and we were able to learn to read and write through the normal mainstream kind of ways. Working in the industry, it doesn't necessarily always help everybody to sit down in front of either a person and be taught to read, write, speak, whatever. How quickly do we action alternative provisions, SEND provisions for those children that need them? Do we have a time frame regarding those? Because I know APs are becoming the big thing at the moment in terms of obviously taking children that necessarily find themselves outside of a mainstream school.
The main focus for a child really should be in mainstream inclusion in education, because actually that should be where all inclusion should be available within it. However, if a school wishes for a child, the school will do that themselves, so they would look at any alternative provision themselves, and that would be done through the school, because that's the school holds a registration for that child. So anything like that would be done by the school, and the school would be very much the person to have the individual conversation around the alternative provision. It is not something necessarily would be a direction from us as council.
That's Councillor Dale. Thank you very much. Councillor Bill.
Thank you, Chair. I hope this committee is going to thank the teachers, the support staff, the lunchtime, those who work in the offices, the caretaking staff for all they do, because sometimes it's a little bit tough to be a teacher. And I have to declare, Chair, that I was the Vice Chair of Matt's school for about 12 years, I think it was it not? I think there's a couple of things that have been raised. Attendance. I mean, I was a head teacher and I never had any trouble with attendance figures, because in my day, the school year started on September the 1st and it ended on May the 31st. So if anybody wanted to go for 6 weeks somewhere else to visit family in the Asian subcontinent, I used to say, as long as you go after May the 31st, I don't care. And there's a huge number of families now who pay willingly to take their children on holiday during term time. And it's my personal view is, And I could say which Secretary of State it was. It was Michael Gove, the person I hate the most in the world, who changed that. So we sort of criminalised families simply because they want to do the right thing. As far as I was concerned as a head teacher, all the exams were over by May the 31st. Anybody who knows anything about primary education knows that those last 6 weeks of term are all about celebration, visits, and all that sort of thing. And that brings me back to the other thing I really want to raise, is the importance of the arts. I think our curriculum has been strangled. I hate it. My daughter says I'm a dinosaur. You were trained in the 60s, Mum. Well, I have to say I'm jolly glad I was trained in the 60s, because when my only headship, I was appointed to a school in special measures, and I had a look at it, and I'll have to write a book about it one day, because what I went through. But the one thing every child in that school could do, they could sing. We could dance, you name it, we could do all those things. And as soon as they had a skill, some of our oldest ones called it getting their red stripe at swimming. If you could do a width at the swimming pool, you had a red stripe, and you suddenly went up in the world. It's giving them those great experiences. And I just think the curriculum really, really needs a shake-up to increase that. And I know you'll agree with me, being a music teacher. So, and I just want to finish on Dudley Performing Arts. It was one of my charities, the Friends, and they got £13,313, and we should have given it on Halloween, shouldn't we? But I wanted them because my daughter's benefited from Dudley School's music service. Elizabeth still plays the bassoon in the symphony orchestra. Sarah still plays her saxophone to those poor kids down in Folkestone. Whenever a boring day, she just gets it out there and plays to them. And it's such an important part of growing up is the arts. So I'm hoping with a review of the curriculum, we actually do something about getting the arts back into school. And I'm just going to finish, Chair, because I'm going to end with wouldn't you agree? The only other thing is early years. I was a lucky head teacher. I had Sure Start. But the question was asked, when do children get picked up for special needs? I can tell you now, from the minute they were born in Wednesbury, we knew, because the Sure Start, you had your health visitors there, and the family and the parents were all involved right from a very young age. I went to a school, because, I've just come off a year being the mayor, and I went into a school with one of those special units that we have for SEN, and I said, when were these children picked up to have special needs? 3 years of age. Think what we could have done with those children if they'd been picked up earlier. So I'm just going to finish there with thank you for your report. I've got a pending Ofsted at Halesbury, as you know, any day now. Monday mornings, apparently, you get the phone call, so we all have to wait till then. But thank you for this report. Thank you to all those who work in education. You do a fantastic job. And I hope everyone will agree with me that we need to thank everyone. Thank you, Chair. Oh, and wouldn't you agree with what I've said? That's my question.
Yeah, thanks, Chair. Just two quick questions, really, just to sort of for me to put myself into a pattern of knowing where this is going. You talked about exclusions, and over the years there's been a rise in exclusions, and obviously I think as an alternative to exclusions, officers, I just need to know what sort of work is going on that you're looking at the alternative to exclusions, and have you identified anything, and it's sort of, if there is a rise, and there's obviously going to be a lot of children there, so where are we sending them, what's happening? So that's sort of question one. And secondly, I should know the answer to our Black Country Music Hub. Is that in Merry Hill by any chance, or am I? It is? I'll answer that then. So just question one then.
Well, that's an easy one to answer. The second one They are based in Cable Plaza, where Children's Services are. So they're on that lower floor. So that's where a lot of their rehearsals based at. So yeah, they're based in the same building as Children's Services.
Yeah.
In terms of exclusions, I think we need to remember there are 2 parts. The exclusions, which is obviously that final decision a head teacher makes, and when that head teacher makes that, it's not, it's for a variety of different reasons, which they have to make sure they follow the level of law around an exclusion. Suspensions we are reducing, and I think it will have an impact longer term, and we will get to a point where we reduce exclusions. We have a pathway strategy that has now been going as part of our standard AP sufficiency now for a couple of years. It bore out of our DVV. It was part of the reason why when I left Leases High School and came to work within the council and work within the inclusion team, was to help support an idea of what we could do differently. We have schools now that have what we call pathway learning centres. So some of our schools have pathway learning centres. Essentially, they become an alternative provision, but they're still being educated within a school. They're still getting some of the core curriculum, but I've also given some additional curriculum and different curriculum sometimes to work along. That's working well, and we have managed to reduce some of our exclusions because of that, and we've been able to place some children into our pathway learning centres. That's just part of it, because part 1 of our pathway strategy is about schools actually looking at that data themselves, looking at the interventions that they can do and look at preventative work themselves first as a school. Then we have our inclusive pathways team, who then go and do some kind of casework. And then we get to the point on our third element, which is then these PLCs, our pathway learning centres, which is our alternative provisions in schools. We then also have now quite a significant tier 4, and that comes out of the flexible learning framework that has gone through different parts of also the council. And that is very much looking at quality assurance of tier 4, which is alternative provisions that are outside of our of what we would normally use, but actually still could provide the right curriculum for a child. So similar to the question essentially that I think Councillor Dale was asking about that alternative provision, because sometimes there are curriculums that need to be more adaptive for a child. And so what we look at is when we're then triaging a child that has gone through an exclusion, we will then go back and challenge the head teacher to make sure they've done absolutely everything first. And sometimes the head teacher will change that. Sometimes it will be overturned by a governing body, an exclusion. Sometimes a parent has the option once an exclusion goes in to go to an independent review panel. So there are different elements for sometimes exclusions could be turned over. But ultimately what we always try and do is challenge first back to the school to say, it is your final decision, but you ultimately as a head teacher make that decision when it comes to exclusion. So there was a significant amount of work that we are doing, and we are starting to see the fruition of it. It will just take that little bit of time to embed into schools.
Anything else, Councillor Lenny? Sorry, I don't know your name, madam. It's just...
Katie. Hi. So you said that the new Ofsted inspections can't be compared with the old Ofsted ratings. How will that be communicated to parents in the coming years when they come to select a school for their child?
Okay. That's a question really for the schools to look at themselves with them, but also it's an important thing that Ofsted are needing to do, and I know Ofsted are doing a lot of that communication as well. Obviously they did the big listen, which is very much an important part of it, but when schools then start to open for like admission, so like coming into reception, coming into year 7, that is going to be an important part for head teachers to be able to explain that difference in it. The report cards when they come out are very clear. I've seen a couple of the report cards that have now been published. They are very, very clear for a parent to understand what it is saying. It's probably a better report card now than it's previously been, but it is just a different benchmark and a different level in terms of it. The benchmark's been certainly raised.
Anything else?
No, thank you.
Councillor Little?
Yes, thank you, Chair. If there's no other questions, I'd just like to mention about some really important work that we've been doing. So a lot of the questions asked tonight around education, we've been working with the Parent Carer Forum. I I think I've mentioned this to a few of you, and Councillor Ridley and I were, was it yesterday or the day before, we were on finalising it, about a training package for elected members. So as it helps, you know, certainly since I got elected a couple of years back, that help and support, what resource is there to guide us through this really, as we hear tonight, it's a really complex world of education, from admissions, elective home education, SEND needs, EHCPs. There's that many acronyms. There's that much. How does that interact with this, and what does that mean there? And you know, differing thoughts about attendance and people taking time off. So all of those. The intention is that we've put together a working package anyway, a training package, with the help of the Parent Carer Forum and the education team, Matt's education team, and specifically to kick it off around SEND, because that, as we all know, with falling pupil numbers but increasing complexities around behaviour and need, we felt that that was a real way to start this off. So as councillors, when they're contacted by, and it's for MPs as well, MPs and councillors, when they're contacted by their residents with questions, we're directing them into a place where we can find answers for that. I'm really pleased to say, and Councillor Hanif, you'll be the first person I want to invite down to Cable Plaza on the 18th of March, I think it is, isn't it, Councillor? I think we got it. I'll just double check on my thing. Yeah, Wednesday, the 18th of March at 6 o'clock, down at Cable Plaza is where we're planning to do it. Because I want as many of the elected members to come, and I think getting 72 down there is probably going to be a bit unrealistic, but let's aim high, build it and they will come. We will be putting some food on, and some of the SEND team and education team will be there, and the Parent Carer Forum, it is that day, yeah, will be there to give some information, and we will be then launching digitally on the Council Contact website that we use, where we raise casework. The resource will be on there, and we've got some other things that we're thinking about further down the line, with some short podcasts talking to individual officers, asking questions that we all want answers to, and then making those available within that resource, not just for the current members, but for those members that will likely come and go in May this year, and the next, and the next, and the next, because we've got a constant cycle of new members that come. So we want to create a legacy that can help all elected members when they come to Dudley Council, so we can know our children in Dudley, the systems that we're working within the education, and try and help as much as we can. So date for in your diaries, 6 o'clock, 18th, down at Cable Plaza. You'll be most welcome. Thank you. Thank you, Chair.
Okay, thank you very much. I'm going to wrap up the discussion there, because I'm not seeing anybody else who wants to speak. I think that what we've heard there is a curate's egg of a report. Good in parts, room for improvement in others. I'm going to suggest that with the recommendations, we just add a little bit of wording, that we obviously note the recommendations to the report. We add in our thanks, our sincere thanks to all officers, teaching staff and support staff in our schools who've contributed towards this, the improving picture. I think just picking up on the point where you've left room for additional scrutiny, I think just summarising the contributions we've had tonight, then the particular areas for focus of for future scrutiny will be around attendance, exclusion and deregistration. So just with those slight amendments to the recommendations, I think we can probably pass that. I'm just going to take a raise of hands. If anyone has any objections, speak now. Okay, thank you very much. And thank you very much, Matthew, for presenting that report. I'm going to move on now to item number 8, which is the Ofsted Focus Visit Findings and Current Service Priorities. That's pages 37 to 44 in your packs. Can I invite John McElwraith to present the report, please?
Thank you, Chair. Good evening, everyone. So this is a report on the findings of the Ofsted focused visit, which was undertaken in October last year. A focused visit is part of the inspection of local authority children's services. So in between the cycle of a full inspection, you would have a focused visit. This was a focused visit. it was the last focus visit before Dudley Council's children's services are re-inspected. We are in the re-inspection window, which is usually 3 years and 6 months since your last inspection. So Dudley Children's Services last inspected in October 2022. So our focus with this report is how does it help us prepare for inspection. So this report talks about the focus visit, if you like, which is set out in section 3 of the report. It had a focus on the quality and impact and timeliness of assessments. It had a focus on the front door and how well we're responding to children in need. The report also goes on to highlight some of the strengths, areas requiring accelerated or immediate action, and areas for strengthening practice. On a positive in terms of the strength, I think it's always worth noting where children are seen and heard and increasingly involved in their plans, social workers build positive relationships and develop genuine understanding of children's lived experience. That's about children and social workers building a good relationship, so the plan is hopefully based on their lived experience. You can see there at section 4.2 some of the areas requiring further improvement. I think it's fair to say overall what that is saying to me is some inconsistencies, and to improve we need to try and strengthen across the board our practice, our management oversight, partnership arrangements, and reduce the inconsistency across the 1,900 children who are open to children's social care. There's some further practice areas requiring immediate strengthening, so looking at management grip, and we've introduced some arrangements only very recently about how we provide tighter management oversight, how we have better management grip, how we give direction around casework, how that is overseen by senior leaders in children's services. So the children we are most concerned about or the most worried about, we're having updates around on a regular basis so that we can provide assurance that we're keeping those children safe and their plans are progressing positively. The report references the progress since the last visit, which was positive, that there has been some progress, and that is acknowledged by Ofsted. I'd want to close by saying, you know, the most important thing is the clear forward-looking improvement plan, which is updated regularly. You've got the 6 areas there where we're focused most of all on improving our arrangements to support children in terms of help and protection practice, because that's one of the domains of the inspection, and also looking at how we improve multi-agency arrangements and partnership working to support children. Because I know even in the time that I've been here, you have commented on it takes a village or a borough to raise children, and that's right, and it takes all of our partners to support children's outcomes to be consistently good. It's not just the Directorate of Children's Services in Dudley Council. So we're also adding into that list of priorities, you'll be, I hope, reassured to know, preparation for inspection, and that will include the refresh of our improvement plan and starting work on the development of our SEF, our self-evaluation form, which we need to share with Ofsted by the end of the first week after we receive a call on the Monday morning. Ofsted will ring on a Monday morning, and then the inspection starts the following week on site. There's 2 weeks of on-site activity, but by the end of the first week, we're having to send them a lot of data, child level data, cases that we have audited recently, etc., etc. So the work begins in earnest on day 1, but inspection team don't arrive into Dudley until the start of the second week, which is the second of the 3 weeks, the final 2 weeks being on site. Thank you, Chair.
Thank you very much. Open the floor to comments and questions. In that case, well done, John, well done. In that case then, I think it just moves for us to approve the recommendations from this report and thank the officers involved in producing it. So that brings us on to item number 9, and there are no questions submitted under Council Procedure 11.8. So with that, there are no further agenda items. Declare this meeting closed. Thank you all for your attendance and your contributions, and a special thanks to Councillor Westwood for her assistance this evening. Thank you very much all. Safe journey home.